Let's bring him in and talk some sports medicine with us. Dr. Joe Congini, Akron Children's Hospital Sports Medicine. And Joe, part of the sports athletes, part of sports medicine is getting ready the right nutrition inside us, eating properly. And you want to go down that road this morning.
Yeah, I do, Ray. Thanks. Sports nutrition, really important part of sports medicine. And in all sports, I've had around this time of year, or a couple months maybe before this, start to see particularly maybe some of our track athletes that are getting geared up for the big meets coming up in the next few weeks and culminating in the state championships and everything. And there's a lot of a push to what's called eat to compete or eat to win and things like that. And we so very happy that we have a good member of our sports medicine team who's a sports nutritionist, dietitian, who sees a lot of our athletes this time of year. But also a lot of our kids are really pretty sharp and wanting to read on their own. And so we give them ideas and books that they can read and look at it to eat to compete. And just a couple of concepts that I want to just touch on today. Number one, you really have to start out by considering what your caloric needs are to cover what your workouts are, making sure that you're getting sufficient calories in to maintain that ideal body weight that you want to be at. You don't want to be on the trend where you're losing weight rapidly or, on the other hand, gaining weight. And you really want to know what's good fuel that you can put in to get sufficient calories. And a lot of the fuel comes from what are called the macronutrients. The macronutrients, of course, are carbohydrates. Carbohydrates, number one, 45 to 65% of the diet of most of these athletes should be carbohydrates. This is the preferable fuel for high-intensity athletes in most situations. So you know carbohydrates are important. There's also the issue of before big competitions of how to do carbohydrate loading, and those are all issues that athletes read about or talk about with our sports dietitian. Number two, of course, is protein. You must keep a certain amount of protein in your diet for sure. It's recommended somewhere between 10 to 35% of the protein that are the building blocks and the amino acids to build and repair muscle and other tissues. So protein's important too. And you cannot eliminate fats totally from the diet at all. They're very important for athletes. Typically 20 to 35% of the diet would be in fats, and they maintain hormone metabolism, neurotransmitter, nerve function, vitamins that require fats. So fats are important to keep in the diet too. Our athletes talk a lot with our sports nutritionist a lot about meal timing and snack timing and what are ideal snacks and meals to get those appropriate amount of macronutrients that we just talked about with carbs and protein and fats. This time of year, Ray, we got to make sure that our athletes are aware of hydration too. I mean, year round, and we see in our fall athletes and winter athletes just as much, but especially as the weather has become warmer now and we're losing more through sweat, losing more from the standpoint of hydration, and many of our athletes are going into competition 2 to 3 to 5% dehydrated, and of course they're going to have significant effect on their performance. So there are factors that we look at sometimes to help them to see if they are optimally hydrated at this time of year. We have talks with athletes about vitamins and minerals. Very, very important. Probably the number one for a lot of our endurance athletes are iron stores. Many of our athletes are low in iron. They may be, frankly, anemic, where they have early fatigue in their workouts and they are anemic. Many of them, though, may have normal red blood cells, hemoglobin hematocrit. They're not anemic, but they're low on their iron stores, and they need to optimize those iron stores. We check a thing called Serum Ferritin in a lot of our endurance athletes. They come in to see us to talk about that, and then how to get those iron stores up rather quickly to try to be ready for optimal competition. We never try to forget vitamin D either. It's so important for bone health. and we run into things with stress fractures and injuries and other issues, we need to make sure that we're checking our vitamin D levels and that we are getting enough vitamin D in. And a lot of kids ask us and athletes about supplements. There are some supplements that can be beneficial, but a lot of supplements are really not proven to be beneficial. And athletes chase around spending a lot of money and a lot of time on supplements that are not going to be helpful to them from a performance standpoint. And that's where our sports dietitians, reading a little bit more, some of the good books about Eat to Compete, or asking your sports medicine professional can be extremely helpful. So those 5 or 6 different areas that I talked about are things that really need to be looked at early in a season for an athlete. I mean, our fall athletes should be thinking about them now. Our spring athletes should have been thinking about them a couple months ago. And the people that will be standing up on the medal stand in first and second and third place down at the state track meets are many people that learned a lot about the importance of nutrition and are doing it appropriately. And if we need help, sports medicine is always there to help. Sports nutritionists on our team are there to help them as well.
Great stuff this morning, Joe. Really good. Way to cover the whole thing. Joe, thank you so much. Enjoy your longer weekend, my friend, and we'll get back together next week. Thanks for the time.
That sounds great, Ray. Thank you. Have a great weekend.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, on board with us this morning.